This is exercise 37. It deals with respiratory physiology. This will contain some explanations for the different types of readings that you will be taking on the worksheet that has also been posted, that it goes along with this particular exercise. Some of the vocabulary with respiration, pulmonary ventilation or breathing, that's just movement of air in and out of the lungs. Internal respiration is the exchange of oxygen and carbon dioxide between the blood at the body cells. External respiration is the exchange of oxygen and carbon dioxide between the lungs and the blood. So we use some of these terms to distinguish where is this gas exchange occurring, in the lungs versus in the tissues other than the lungs. Transport of gases looks at how the oxygen and carbon dioxide are carried in the blood between the lungs and then throughout from the rest of the tissues. This exchange of gas that occurs inside the lungs between the blood and the lungs, it's between the alveoli and the capillaries that surround the alveoli as part of the pulmonary circulation. What happens here is that the pressure, the partial pressure of oxygen in the alveoli is greater than the partial pressure of oxygen in the blood, in the capillaries. And so what happens is the gas is going to flow down that pressure gradient, just like you saw in diffusion, where things will move from an area of high concentration in the liquid to an area of low concentration in the liquid. The same thing happens with pressure. It moves from high pressure to low pressure. So because the pressure of the oxygen is higher in the alveoli than in the pulmonary capillaries, then that means the oxygen will move out of the alveoli and into the blood and the capillaries. The carbon dioxide pressure is reversed. It's higher in the blood than in the alveoli. So the blood, as it comes into the lungs, goes through from the arteries down to the arterioles, down to those capillaries that are surrounding the alveoli sacs. The partial pressure of the carbon dioxide is higher in the blood than in the alveoli, so that the carbon dioxide will flow out of the blood into the alveoli, and then you're going to end up exhaling it. It's a way of getting rid of that CO2, a waste product. The internal respiration, that's the exchange of gases between the blood, now at the capillaries that are throughout the rest of the body other than the lungs, and the tissues, the cells that are right there among them. So basically, exchange of gas between blood and all the other tissues other than in the lungs. Because this blood has already gone through the pulmonary circulation, you're now talking about systemic circulation. So initially this blood is going to be high in oxygen concentration. The pressure is going to be higher now in the blood than the partial pressure in the capillaries. So the oxygen is naturally going to flow out of the blood. Carbon dioxide is a waste product that builds up in the tissues, and so the partial pressure of the carbon dioxide is higher in the tissues than in the blood, so it flows out of the tissues into the blood. So usually what you're having is oxygen and carbon dioxide. They're moving in opposite directions, both in the lungs as well as in the tissues. The respiration obviously has to work along with the cardiovascular system because that's the transport system for the oxygen and the carbon dioxide. Most of your oxygen is going to bind to the hemoglobin. The carbon dioxide, when it diffuses into the blood, most of it will be converted from carbonic acid, and from there it goes to bicarbonate ions and hydrogen ions. And that is how it will be transferred in the blood in the cardiovascular system. On here you can see there is the chemical equation right here, showing the equation for the carbon dioxide, CO2, and how it's converted to carbonic acid and then bicarbonate ions. So during internal inspiration, during the reaction, the exchange that's occurring in the tissues, what happens is the reaction tends to go in the direction from left to right. The carbon dioxide comes in, forms the carbonic acid to the bicarbonate. During external respiration, that is the process that's occurring then in the lungs where the blood is coming, and this is the form that most of the CO2 is carried in, and so the reaction goes from right to left in the blood. During normal inspiration, inhaling, the diaphragm is going to be the main muscle. You're also going to have the external intercostal muscles that are involved with this normal inspiration or inhalation. If you try to take in a very deep breath, so it's forced in, it will include these additional muscles down here, such as the sternocleidomastoid, pectoralis major, pectoralis minor, and serraceous anterior muscles. During normal expiration, when you're exhaling, the muscles are going to relax, the lungs will recoil. If you force a deep breath out, it's going to involve the internal intercostals, the rectus abdominis, internal obliques, and transversus abdominis muscles. This just shows one example of spirometers for measuring how much you are able to inhale or exhale. There are several different versions of these. It allows you to take different volumes, ultimately determining what is the lung capacity, how much air can your lungs hold. And there's several different measurements here that it talks about, things such as like tidal volume, TV. That would be the amount of air that you inhale just under regular, normal conditions. You haven't been exercising, you're not taking in a deep breath. There is a related lab demo that does show an example, a video of some, basically, recording volumes using a spirometer. You can see how it is done. The IRV, or inspiratory reserve volume, that's the amount of air that can be forcefully now inhaled after you take a normal breath. The expiratory reserve volume, or ERV, is the amount of air that you can forcibly exhale after normal breathing. Once again, the averages are given here. These numbers will vary depending on, obviously, the individual, whether a person is an athlete or not. Does the person have asthma or some other type of underlying problem? These volumes will change. The residual volume, that's the amount of air that's in the lungs after you have done a very forceful exhalation. Exhale all of the air in the lungs. There's always going to be some residual there. You can take some of these measurements and then, as you can see right here, and then calculate what is the total lung capacity. What's the maximum amount of air that can be in the lungs? You can also use this formula to calculate the vital capacity. That's the maximum amount of air that can be expired, that you can exhale after maximum. You can also measure things such as inspiratory capacity, functional residual capacity. Once again, which type of measurement you take will depend on the specific circumstances. What are you trying to find out? Depend on the condition of the patient. Are you just trying to determine what is the total lung capacity? Are you trying to figure out, are they inhaling and exhaling a proper amount? What's the volume? Does it fall within normal ranges or not? You can determine the amount of gas that's moving in and out in 1 minute time. Normally it's about 6 liters per minute. There are certain clinical conditions that obviously are going to affect the physiology of the respiratory system, such things as pulmonary fibrosis, where you have fibrous connective tissue that builds up. That's going to decrease some of these volumes of how much air you can breathe in and out. What can cause this? Well, several different things. Maybe you've been exposed to different irritants, such as asbestos. COPD, or chronic obstructive pulmonary disorder. Essentially what is happening is you don't have enough air flowing in quickly enough to meet the needs of the tissues. So you have this reduced amount of air, and you have to make adjustments for that. Asthma. another respiratory disorder, where what often happens is the airways, there may be a stimulus that causes the airways to constrict. And so you're not able, once again, to get as much air movement as what you were used to. In hypoventilation, what happens here is you're not breathing sufficiently. The carbon dioxide levels are going to rise. When carbon dioxide levels start to rise, the pH in the blood tends to fall. What happens is you're breathing either too slowly or not deep enough, and there are going to be centers, control mechanisms in the brain and the respiratory control centers that respond to that by trying to increase the breathing rate for that. Just so you are aware, the rate of breathing, one of the things that controls the rate is what is the level of CO2 in the blood. A lot of people think it's the oxygen, but in reality, the major stimulus is as the concentration of carbon dioxide or CO2 increases, that is what is going, as that increases, that's going to be the main trigger to tell you to basically breathe or increase the breathing rate. Hyperventilation is where basically you're eliminating the carbon dioxide faster than it needs to. And so the carbon dioxide levels are going to be decreasing, and what would happen is the respiratory control center, because it's monitoring the CO2, high levels trigger it to increase your breathing. Because you're hyperventilating, you're removing the carbon dioxide faster, so the levels are decreasing. So the typical thing is that the breathing centers will decrease the breathing rate.